The Prime Minister on this Thursday morning.
Bonjour à tous. Today at sundown marks the beginning of Ramadan. For many Muslim Canadians, the coming month will be different than normal, with iftar online and virtual Friday prayers. But that won't change what this special time is all about: generosity, compassion, and service to others. Across the country, Muslim Canadians are on the front lines of the fight against COVID-19 as nurses, doctors, and essential workers. So thank you, and Ramadan Mubarak.
Today, Muslim Canadians will underline the start of Ramadan. The months coming will not be like usual, but the values of compassion and generosity at the heart of this tradition are more important than ever. Across the country, Canadian Muslims are on the front line of the fight against COVID-19. Doctors, nurses, and essential workers. Thank you, and Ramadan Mubarak.
This will be another difficult day for many families and communities across the country. We're all thinking about those in Nova Scotia who are grieving the loss of loved ones, friends, and neighbors. Yesterday, I spoke with the families of some of the people we lost. They shared stories about their loved ones and their dreams and plans. In the face of such tragedy, their strength is remarkable. I spoke also with RCMP members from the area, and on behalf of all Canadians, I thank them for their service. And I spoke with some local mayors as well to express my condolences. For Torontonians, I know it'll be a hard day as well, as we remember the victims of the van attack on Yonge Street 2 years ago. Together we mourn, and together we heal. Because just as Canadians were there for each other 2 years ago, we're there for each other today. Across the country, people are hanging tartan, blue ribbons, and scarves from windows to honor those who died. With acts of kindness and donations, people are standing with families who are grieving. And tomorrow, with the virtual vigil, we will all have the chance to show the people of Nova Scotia that they are not alone. For the
people of Nova Scotia, today will be another tough day. Facing such a tragedy, they are showing an incredible force and incredible strength. And Torontonians are also experiencing a tough day today. They remember the victims of the attacks along Yonge Street 2 years ago. Together, we are mourning, and together we will heal.
These are tough times, but there is reason to hope. When it comes to COVID-19, what we're doing is working. And to continue on the right track, we need to be thinking not just about the next weeks, but about the next months. We need medium-term and long-term solutions. On that front, I can announce today that we're taking another step forward. We're putting in place an additional $1.1 billion for a national medical and research strategy to address COVID-19. This plan has 3 pillars: research on vaccines and other treatments, supports for clinical trials, and expanding national testing and modeling. Let me start with the first pillar on research. Under this plan, we're investing close to $115 million for research into vaccines and treatments being developed in hospitals and universities across the country. This is on top of the funding we've already provided to support vaccine development in Canada. The second pillar of the plan is to make sure that once we have potential vaccines and treatments, we can test a wide range of options. Under this plan, we will invest over $662 million for clinical trials led by Canada. A vaccine is the long-term solution to this virus, but these drugs will take months to develop, test, fabricate, and roll out. So until we have something ready, we need to control the spread of the virus. And that's where the third pillar of this plan comes in. We're investing $350 million to expand national testing and modeling of COVID-19. This includes creating the COVID-19 Immunity Task Force. The task force will operate under the direction of a leadership group which will include Dr. David Naylor, Dr. Catherine Hankins, Dr. Tim Evans, Dr. Teresa Tam, and Dr. Mona Neiner. We are bringing together top health experts and scientists from leading institutions across the country. Canada's best and brightest will be working on serology testing, blood testing, to track and understand immunity to COVID-19. They'll be looking at key questions like how many people beyond those we've already tested have had COVID-19, whether you're immune once you've had it, and if so, how long that lasts. Over 2 years, we will be testing at least 1 million Canadians as a part of this study. The findings of the research will help with everything from rollouts of a potential vaccine to determining which public health measures are most effective going forward. We will get valuable data, including disaggregated data, to understand the impact on vulnerable populations. And we will also leverage new and existing lab capacity for research. The better we understand this virus, its spread, and its impact on different people, the better we can fight it and eventually defeat it. While this vital research is happening, we're also staying focused on what we can do right now to control COVID-19 and get back to normal as soon as possible. Testing is key. We've now reached 20,000 tests daily, almost double where we were earlier this month. But testing must increase even further before we can reopen and restart our normal activities as a country. You've been doing your part by staying home and practicing physical distancing. It's working, and we can't afford to waste this progress.
Today, I'm announcing that we're putting in place a medical and research strategy worth $1.1 billion to fight against COVID-19. The first pillar of that strategy is on vaccines and treatments. We're investing close to $115 million in research on vaccines in hospitals and universities across the country. This is added to the amounts that we've already allocated to develop vaccines here in Canada. The second pillar of our strategy is to make sure that when we will have the vaccines and potential treatments, we will test many use options. We will invest close to $662 million on clinical trials. And the third pillar is to invest in tests to modelize the sickness, the disease. And we're putting in place the task force on immunity against COVID-19. This work group will be led by Dr. David Naylor, Dr. Catherine Hankins, Dr. Tim Evans, with the support of Dr. Tam and Dr. Neiner. They will coordinate blood tests that will help us to retrace the virus and to better understand how we can immunize against COVID-19. The conclusion of this research will help us to do many things, whether to make a vaccine accessible or determine which public health measures are the most efficient and must be adopted. As we are going through this vital research, we continue to think about what we can do right now to contain COVID-19 and get back to a normal life as quickly as possible. Tests are what are the most important element. We're at about 20,000 tests daily across the country, but we need to increase our capacity to test before life gets back to normal.
We're seeing terrible tragedies in long-term care facilities across the country. This is unacceptable. If you're angry, frustrated, scared, you're right to feel this way. We can do better. We need to do better. Because we are failing our parents, our grandparents, our elders, the greatest generation who built this country. We need to care for them properly. Canadians need to pull together. There have been requests for military assistance by both Ontario and Quebec, which of course we will be answering. Our women and men in uniform will step up with the valor and courage they have always shown. In the short term, we will be there with support so that provinces can get control of this situation. But this is not a long-term solution. In Canada, we shouldn't have soldiers taking care of seniors. Going forward, in the weeks and months to come, we will all have to ask tough questions about how it came to this. We will all have to do more to get through this terrible situation. En ce moment,
right now, we see terrible tragedies in the long-term care centers across the country. It's unacceptable. If you're angry, frustrated, worried, you have every right to feel like this. We must do better because we're letting down our parents, our grandparents, our elders, the members of the greatest generation who built our country. We need to take care of them as they should. Quebec and Ontario have asked help from the army and the military. Those are the requests we will accept. Our military will go and help out where they are asked, as always. But it's not a long-term solution. In Canada, it's not up to the military to take care of our elders. In the coming weeks, in the coming months, we will have to examine how we got to this point. We will all have to do something to get through this terrible situation. Everybody does its part to get through this period. We all are members of the same team. As we do our part, I know that everybody will do its part, and together we will get out of this, and together we will come back strong. Thank you.
Thank you, Prime Minister. We'll now go to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. First question, Althea Raj, Huffington Post. Line open.
Good morning. Yesterday you said you were going to continue working with the Finance Department and business associations to ensure that small businesses will get the support they need. Many self-employed individuals feel like they have been forgotten. They can't apply for interest-free loans because they have no payroll, and many have thousands of dollars in fixed costs every month, so the CRB changes really do nothing for them. They feel that your government has been more focused on employers and employees, and many face the real possibility of losing their businesses or going bankrupt. So could you tell us what changes you are envisioning for them?
As we said from the very beginning, we worked on measures to help as many people as possible. We brought in targeted measures to help people who'd lost a paycheck, including people who were self-employed. We've moved forward with a wage subsidy that ensures that people who can remain connected to their jobs while receiving 75% of their paycheck, up to $847 a week. We know that these are measures that got out quickly, are getting out quickly, and are broad and are helping millions of Canadians. But we also know that there are people who are falling through the cracks. That is why we continue to work with industry groups, with stakeholders, with MPs and community members across the country who are feeding us challenges and possible solutions. And of course, we are working with an extraordinary public service to deliver those solutions to Canadians.
Follow-up, Althea?
Okay, but that doesn't, well, that's your answer. Do you regret this patchwork approach regarding the CERB? It's clear that the need is a lot greater than the government anticipated when it drew up the program weeks ago, and I know that there are a number of people in your caucus who argued that it would have been far easier, and it would be far easier to give everyone who's lost income or lost the opportunity to earn income the ability to apply for help and just tax it back from those who perhaps didn't need it as much next year. I mean, did you make the right call, and are you so stuck on this current course of action that you will not deviate from it?
We knew from the very beginning that targeted support to the people who needed it was the best way to do it. And that's why we move forward with the Canada Emergency Response Benefit that has delivered benefits to over 8 million Canadians. Why we move forward with the Canada Emergency Wage Subsidy that is ensuring that people can stay connected to their workplace, even if they're not actually doing the work anymore, so that we can bounce back quickly. But every step of the way, we've said we will continue to expand. We will continue to fill gaps. We never expected that we'd get it perfect from day one. Indeed, we knew we wouldn't. But we couldn't let the perfect be the enemy of the good. We needed to get things out as best we could, as quickly as we could, to help as many people as possible. And then we continue every day to make further announcements that fill gaps, that explain how we're going to help those people who aren't hit by the broad measures there to help. We will continue to work on making sure that everyone who needs help gets it.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Oui, bonjour, Monsieur Trudeau. J'aimerais revenir à
Mr. Trudeau, I'd like to go back on the announcement that you made yesterday regarding students. There's right now a lack of people in the long-term care centers. We are fearing a lack of workers in the agricultural sector. And it seems like this measure will be disinteresting students to go to work in some areas where they don't offer large salaries, for instance, in the retail sector. Would your measure lead to a shortage of workforce? Students need help. We acknowledge that it's the situation of COVID-19 is hitting hard against every generation, and we need to be there to help them. We've put in place a program that will also develop jobs for youth across the country. We talk about 76,000 new jobs in targeted sectors that will be able to benefit from the help of those youth. I know you, young Canadians. I know the youth across the country. They will want to be part of the solution. They will want to be able to help and contribute to the economic relaunch of the country, and have the money in order to cover their rent and cover their grocery and be sure to get back to their studies in the fall. It's the right thing to do, and we will work together in order to have the necessary economic restart. But I'm not excusing myself to pay our students during those tough times. As a follow-up, Conservatives today have proposed that Ottawa creates a similar program to what we see with the summer job program, but this one to motivate youth to go and work in the agricultural sector. There will be a lack of workforce because there's not enough foreigners coming to work, and those are not really attractive jobs because they're not really high-paying jobs. Is this an idea you find interesting? And if not, why? Every year we see youth interested by the agricultural sector, by the idea of going back to their roots and going to. We have a very green young generation and interested into what is bio or organic and agricultural. I know that many youth will be interested, and there will be opportunities and an opening to bring them, and we will create incentives and programs in order to lead them into the useful and important sectors. I have lots of trust in our youth that will be part of the solution to this crisis by which we're going through.
Merci. Prochaine question, operator.
Thank you. Merci. Next question, Ryan Tunnelty, National Post. Line open.
Yeah, morning, Prime Minister. I'm wondering, there are a number of U.S. states that are starting to ease restrictions, opening up businesses again, starting as early as tomorrow. I'm wondering if you're concerned about jurisdictions that are so close to Canada easing their restrictions so much, even while in some cases their virus numbers are still going up.
We have strong border measures in place to ensure that we're doing what we need to do to protect Canada. As provinces look at their own situation and how we can move forward on beginning to reopen our economy, I know that their decisions and our decisions will be informed by what is working and what is perhaps not working as well elsewhere in the world. Okay.
I know that we will continue to have measures in place in order to protect our border and make sure that we are protecting the safety and health of Canadians. I know that provinces and the federal government, as we are thinking about what will be the steps in order to open up the economy, to relaunch the economy, we will look attentively at what has worked and what might not have worked in other jurisdictions in order to take the right decision.
Follow-up, Brian?
Yeah, I'm also wondering about the Federation of Canadian Municipalities is out today with a request for $10 billion in emergency funding because their revenues have fallen so steeply during this crisis. Are you starting to work with municipalities on a package for something like that?
We recognize that levels of government across the country, orders of government across the country are facing distinct challenges. We've had a number of conversations with the provinces on their financial challenges. And as we know, municipalities are governed by the provinces. We will continue to work with the provinces, but we'll also continue to work directly with municipalities to make sure that Canadians get the services they need, get the support they need, regardless of the orders of government. We all serve the same people, Canadians, and we need to work together to be there for them. Okay. Nous allons toujours travailler pour être là pour les Canadiens qui
to be there for Canadians who need the services and the support during these difficult times. And we respect the authority of the provinces regarding municipalities. We will continue to work with the provinces on the issue of municipalities and in many cases with the municipalities directly when it's appropriate.
Thank you. One more question on the phone, please. Operator.
Thank you. Merci. Prochaine question, Émilie Bergeron, Agence QMI. À vous.
Oui, bonjour, Monsieur le Premier ministre. J'aimerais revenir sur
I'd like to get back to the help brought to Quebec in the long-term care centers. We're talking about 1,000 troops as requested, and you spoke about lessons to learn from this. In terms of Quebec, what was not done properly in that regards? It's been years we've been talking about problems in those institutions. Well, first, regarding the help requests, like we've answered positively to all the three first requests sent by the province of Quebec, we will respond to this one as well. And we are currently working with the province of Quebec to see how we can help in the best way possible. We've got the requests last night, so we are working with them to coordinate the best response in terms of numbers and the necessary areas. In terms of lessons to learn, I think there will be a lot of questions, important questions to ask and answer in the coming days and weeks and months and years to come on how we are supporting our elders in this country. I think this crisis is underlining that there are some challenges that we need to get through together. So if I understand you well and understand your response, we're not fixed in terms of, we're not settled on the amount of troops. We talked about 1,000, but you spoke many days ago about also a contribution of volunteers and the Red Cross. How many extra people could be sent? Listen, we will be there to help. People are facing just a terrible situation, and we'll be there to help the province of Quebec to get back on in a control position in this situation. It's extremely troubling and sad, and we will be there with troops like we've been. I think there's 350 troops already on the ground in the long-term care centers across Quebec, and we will send more. We will be working with the province of Quebec and with the volunteers of the Red Cross. Everything we can do, we will be there one for the other, and that's what we've been doing. And what we do as Canadians, we are there one for the other. In times of crisis, we will be there during this difficult time.
Hi, Prime Minister. Molly Thomas, CTV National News. The race for personal protective supplies allows for a way out of China. It's been 500 days since Canadians Michael Kovrig and Spavor were arbitrarily detained. Are you any closer to getting them released? And when was the last time they had a chance to meet with consular officials?
We have been working extremely diligently on the issue of Michael Spavor, Michael Kovrig, who have been detained for 500 days in China. This is something that we have taken seriously from the very beginning. I can highlight that the Minister of Foreign Affairs spoke to his counterpart, very recently to express our continued concerns and desire to see them released soon. The COVID-19 crisis has the Chinese system in a position of not allowing consular visits, but we have been assured that they are in a facility in a region that is not particularly affected by COVID-19, although we are continuing to press both for more details and for better access.
Also, Prime Minister, we've seen a spike in anti-Asian violence in different parts of our country. In BC, an elderly man with dementia was shoved out of a store by an assailant that brought up remarks about COVID-19. We now have a Conservative leadership candidate that is asking for Dr. Tam to be fired and is accusing her, the WHO and China, of being in cahoots. What is your message to Canadians as they see this?
Intolerance and racism have no place in our country. Canada has succeeded because of our diversity. It is one of our greatest strengths. And the millions of Canadians of all different backgrounds who are working together, many of them on the front lines to help their fellow Canadians, deserve better than this from all of us. We need to continue in our resolve to be an open, welcoming, respectful country. And I think all Canadians expect that of every politician.
Intolerance and racism have no place in Canada, and certainly not in our public discourse. Our country is strong, not despite its differences, but due to its differences. And people from all kinds of background and ethnic origins work one with the other, side by side, to fight against COVID-19 and help their loved ones and their fellow citizens. We must, in those times, gather and not accept intolerant words.
With one meatpacking plant already closed in Alberta and the NDP in that province calling on 2 more to be shut down, I'm just wondering, what is the federal government doing to protect Canada's food supply from the effects of COVID-19? And are you worried about federal inspectors going into these plants?
We are, of course, very alert to the issue of food supply in Canada. Food security for Canadians is a continued essential priority. We will work with the agricultural industry. We are strengthening processes around the CFIB to ensure both protection for our inspectors and effectiveness in assuring the safety of our food supply and of the conditions in which workers find themselves. We will continue to work with provinces and various jurisdictions to ensure that we are making sure that Canadians get the food that they need.
And in terms of vaccines, you announced earlier funds for vaccine development. I'm wondering if your plan is to have vaccines manufactured here in Canada for Canadians.
We know that developing vaccines is a really important step, and that's why there are brilliant researchers working across the country in coordination and in collaboration with the international community as we all make efforts to develop a vaccine. But once we've developed a vaccine, whether it be in Canada or elsewhere around the world, we're going to need to produce it. And we will see the same kinds of pressures that we're seeing around obtaining PPE around the world to obtain vaccines, which is why part of the investments we're making today is to establish the capacity of developing vaccines and producing vaccines, mass producing vaccines here in Canada. Okay. Oui, la vaccination va être un élément.
Vaccination will be an essential element of a way out of COVID-19. That's why we are investing in research in order to for Canadians to be part of this research to find a vaccine against COVID-19. At the same time, we need to make sure that we produce this across Canada, and that's exactly what we will do. Quebec is starting to talk about a possible eventual reopening of certain areas. Yes, Saskatchewan later will unveil the reopening of its economy. PEI will reopen some businesses in mid-May. In your point of view, is it too early? Or provinces are moving too fast? I believe that everybody wants to know when we will be able to raise a few restrictions, when we will be able to get back to some kind of normal life. The reality is that until the moment that we have a vaccine, we won't be able to talk about normal life. But we will be able to release a few measures in appropriate fashion while staying extremely vigilant and continuing to do a lot of tests. Many provinces, different provinces are in different places in their fight against COVID-19 and will make appropriate decisions. At the federal level, we're trying to coordinate and to make sure the shared principles across the country in order to make sure that there will be a common approach and measures that will be comparable across the country. However, there will be the times where it will be introduced will be different from province to province.
We know that everyone wants to know when this is going to be over, when we're going to be able to get back to normal life. Well, until we have either a vaccine or significant treatments for COVID-19, we're not going to be able to talk about getting back to normal. But in the coming months, we will be able to loosen a number of the restrictions and rules that we have right now on personal mobility in certain sectors, on the economy. Different provinces are in very different postures related to COVID-19 and will be taking decisions that are appropriate for them. What we're doing at the federal level is attempting to pull together and coordinate all different provinces so that we are working from a similar set of guidelines and principles to ensure that Canadians right across the country are being kept safe as we look to those next steps.
You said earlier that you're doing about 20,000 tests per day. It's not enough. What would be your target in order for us to start talking about reopening in terms of daily tests? Dr. Tam has spoke about 50 or 60,000 tests per day as being an important target, and others are saying it could go up to a need to double that. We know that we need to do much more, and that's why we are currently increasing the tests and our capacity of testing.
Prime Minister Julie Van Dusen, CBC. You've talked about the fact that it's unacceptable what's going on in Canada's seniors' homes. You've also discussed the idea of making sure people make more money in those homes, but that, of course, would be a short-term solution. In terms of a long-term solution, will you be talking to the premiers about putting seniors' homes under the Canada Health Act, which would set national standards and hopefully make sure that seniors don't go through such a terrible ordeal again?
I think there are going to be an awful lot of Canadians asking questions of all their all their politicians about what we're going to do to make sure a situation like this could never happen again. What COVID-19 has done has highlighted and brought forward failings in our system, in our country, where the people who take care of our most vulnerable are themselves extremely vulnerable economically. We need to do better, and there will be a lot of conversations that Canadians are going to demand and that politicians will have about what is the best way to ensure that we are properly protecting our elders.
On the issue of the vaccine, which you've said in the past could take a year to 18 months, will we have to wait for a vaccine to hug our family and friends who are outside of our bubble?
The process around reopening, the level of freedom we'll have to visit friends and to work and to go outside will depend on the decisions and the advice that scientists give us around how to keep ourselves safe. We know it may be a long while before a vaccine. There are discussions around treatments for COVID-19 that might work as well as a vaccine. I mean, we've been waiting for and looking for and searching for a vaccine for AIDS for decades now, and it still hasn't come. But there are treatments that mean quality of life for people with HIV have been massively improved. There are different ways of moving through. We will take the best ways we possibly can as we move forward. A vaccine, obviously, arriving soon would be the best solution. But we need to make sure we are exploring all different ways of ensuring that Canadians' quality of life and safety and protection is upheld in the best way we possibly can going forward. Merci beaucoup tout le monde.
And the